Hello, everyone. Sorry, I'm still waiting for the guest. So we're gonna wait for a little bit. He's having a little bit network issue. I think he joined in, but he took off because he need to correct his network. Thank you all for joining us. I don't know who is 416.
William.
Oh, William. Oh, thank you so much
Hey,
for joining
Dr.
us.
Omelu, hi.
Thank you
Is
so much
Henderson with
joining.
us?
Yeah,
Yeah, looking
joining us all
forward
the
to
way
it.
from Canada. We appreciate that. I can see people in Rosamond, and I
Hello.
see Jean, Francos, and Denise. Thank you all for joining now. We're just waiting a little bit. So I'm gonna just have you guys enjoy Mali song, instrumental while we wait. Thank you. Hello, everyone. Thank you so much for joining us today. I hope you all having a great day. And some people from other countries, I hope you're having great night, whatever the hour is. We really appreciate you joining us today. So the special topic for today is sexual reproductive health rights. And we have a wonderful guest. Oh, before I say that, once the session starts, you can be on video if you want. No restrictions on whether you want to be on video or not. You can be on video, but please, if you're not speaking, just mute your speaker so that only the guest and myself can be talking. And then there will be a section towards the end. I will open it up for everyone to speak and provide recommendation and suggestions, or maybe comment or ask questions. The person coming back to see us at Papalic is another brother and a king. His name is Henderson Mhango. He is an attorney and also a social activist. He has a strong business and administrative and management degree. He's very, very well seasoned in human rights and governance activist. He also founded the YOCADE, which is the Youth Coordinating Agency in Development in Malawi. And he is the founder and executive director for this organization. The acronym is YOCADE, YOCADE. In YOCADE, there are different project focuses they actually implement in Malawi. Briefly, they implement a lot of mental health and suicide prevention, which was the topic we discussed last few months. And they also provide sexual reproductive health rights interventions in Malawi, and also early childhood development projects. That early childhood development project, he will be coming back next year to present the information on those. That being said, YOCADE predominantly serve underserved populations in the rural communities in Malawi. Henderson is a leader. He's also has a leadership position in the National Coordinator of Forum for Democracy and Rights Defender. He's also chairperson of Volunteer District Education Network. He is a board member and chairperson of Lifeline AMCAN in Malawi. And finally, he's a chairperson of Human Rights Defenders Coalition's Southern Region chapter in Malawi. There is nothing else to say about this brother. He's really doing a lot of work in the community in Malawi. So I would say, welcome back, Henderson, to the Public Show. And we really appreciate that you have the time to come and see us again. Thank you so much. Appreciate it. So I will turn it over to you if you want to give a shout out to your colleagues so we can begin this interview.
Thank you very much, Doc. I think you have already highlighted a lot of things about our organization and myself. I think we can maybe just go direct into our program if you can allow me to do so.
Okay. And if I may ask, will it be possible for you to turn on your camera, Henderson, please?
Yeah, it is possible, but the moment I turn the camera, I'm having some problems with the network, but I can try to do it. When it is misbehaving, then I will be turning it off.
Okay, we appreciate it. I just want our audience to see who we're speaking with. Okay, so thank you so much for doing that. I appreciate that. So I said earlier that this topic is about sexual reproductive health rights. Without further ado, can you just tell us about, for us to start, just tell us about the population, since this has to deal with sexual reproductive rights in Malawi. Can you briefly start telling us about Malawi population, culture, political system, and spiritual diversity in Malawi, so that, you know, when we deep dive into the main area of sexual reproductive rights, we can understand why the interventions that you're proposing and your organization is doing make sense.
Thank you very much, Doc. First, maybe let me give a brief background of Malawi. Basically, Malawi is a landlocked country in the southern region of Africa, and we are bordering with Zambia, Tanzania, and Mozambique. Currently, our population is 22.2 million people as of now, 2025. As a country, we have also a diverse culture with a dozen of ethnic groups, including the Chewa, the Tumbuka, the Yao, and so many of them. Our population, I've already said, is 2.2 million. And politically, Malawi is a democratic nation with a number of political parties. And we have just elected a new president on 16 September this year. And we have a new president representing Democratic Progressive Party, DPP. Spiritually, we are also a diverse faith, predominantly Christian, and we have at least a population of 77.8 of Christian, while the Muslim are 11 to 13%. So basically, Malawi, what I can say on Malawi about the culture and also population, including our religious, is I think that one.
All right, thank you so much for that high-level summary of the diversity in Malawi and the population size and other stuff. But before I go to the next question, I just want everyone to, I want us to recognize what's going on globally. And if you can see, that's why I'm wearing this. So I'm wearing this to recognize the fact that globally, we are currently going through a genocide. One of the genocide in Palestine, Gaza. There's a genocide. While we are talking about life, because sexual reproductive rights also deal with life, we are dealing with genocide as well in Democratic Republic of Congo. We are dealing with genocide in Sudan. We are dealing with genocide in Myanmar, sorry. We are dealing also with genocide in Ethiopia, China, and also Nagorno-Karabakh. So we need to recognize what's going on globally. These are real things that are happening, and the more we speak on those things that are happening, we can also be able to implement effective intervention in either public health or medical setting or social economics. That being said, if we care more about humanity as a prime reflection of God than the ideation of God, the world will be a better place. And I also believe that this is supported by saying no matter how evils are packaged, either with God, politics, religion, or other forms, only conscious people will see through it. We are everything, but also the observer of everything. I am a point of view of one, with which one knows itself. So I want us to take home these little quotes. The last one is by Federico Fagan. Okay, so now moving forward to the next question I want you to discuss. Can you provide us information about the percentage of women who are at childbearing age in the country?
Thank you, Doc. In Malawi, approximately 28% of adolescent women and girls aged 15 to 19 are already into childbearing. And these statistics show that Malawi is also one of the countries with the high teenager pregnancies. So the teenager pregnancies is coming because most of the young girls between 15 to 19 are already into childbearing. And this is also high in rural areas with 31% compared to urban areas with 31 in rural area, while 21 in urban area. This is also shown that women in poorest household are nearly 3 times more likely to have started childbearing than those in well-to-do households. So 15 to 19 group contribute at least 25% of all the pregnancies annually here in Malawi. So you can see that we have a very big problem when it comes to childbearing and also teenager pregnancies rate here in Malawi.
Okay. Thank you for that information. But before I go into ask the next questions about sexual reproductive rights to understand what are the intervention that is being currently, that has been implemented or is currently being pursued, can you summarize to us about what is it actually the operational definition or content of sexual reproductive right? What is it? Because sometimes the reason I'm asking this question is usually sometimes when we talk about sexual reproductive rights, the default answer goes to either thinking about abortion or thinking about, gender specific. So can you give us a total background knowledge of what sexual reproductive health rights entails?
So basically, sexual reproductive health rights is a concept that every individual has the right to make a fully informed and self-determined decisions about their body and sexuality. To have a free, to be free from discrimination and violence. So this is much concerned about the youth and also other group of people, for example, the LGBTI, who are much neglected when it comes to sexual reproductive health rights.
Okay, thank you so much. So now that we get that out the way, just provide some more detailed information on what areas of sexual reproductive rights, health rights that your organization is pursuing in Malawi to improve.
Normally, what we are focusing as a youth organization, we are looking into youth empowerment. So basically, what we are doing is to make sure we do some prevention on HIV and STIs, and also how the youth can also obtain information on sexuality education, on sexual education in short. So these are the main activity we are doing in the community to make sure the youth, they have the full information on their sexual rights. So that's the main activities we are doing to the youth here in Malawi.
Okay, so doing that, is there specific laws that has been passed or are being passed in Malawi? Because any intervention that usually happens in any community, there will be a series of barriers and challenges. So can we also go over that, because the Malawi is a really rich cultural diversity? Can you take us through what the barriers are and what you guys have been doing to be able to ensure that both genders, men, women, and other sexual orientation have the right for their, making decisions on about their body in terms of sexual reproductive rights?
Yeah, sure. Malawi, like any other country in the southern region, we do also have challenges or barriers when we are doing our intervention in sexual reproductive health rights because of the cultural, the religious, and also the political positions of other laws and the beliefs. So basically, our problem are coming from the cultural aspect. Most of the people, they have the misconception about sexual reproductive health rights. So that misconception makes a lot of young people fail to access the sexual reproductive health rights, including the marginalized group of people like the LGBTI, and also maybe other maybe women who have dropped out of school. So it's a challenge, it's a general challenge when we look at cultural and also religious aspects into the sexual reproductive health rights. However, our country has passed some laws to at least promote sexual reproductive health rights. We have the sexual reproductive health rights policy, which we do follow whenever we are doing our activities, and it was produced by government together with the other CSOs, but still more when we are engaging people in the community, it just differ which community you are, because the culture may also differ where you are doing your activities. So in other areas where they don't understand much about sexual reproductive health rights, it becomes a problem for us to do our interventions. And in those areas, you find out we have more cases of maybe teenager pregnancies, and also unsafe abortion, and so many issues which come with the lack of sexual reproductive health rights services and information.
So here's a probing question I have for this. Okay, so let's look at what in Malawi, for example, what are the main issues that women face in sexual reproductive rights? That's one set of questions. What are the main issues men face? Now that we know sexual reproductive right term apply to any gender, what are the sexual reproductive rights issues that men are facing in Malawi, and what are the sexual reproductive rights maybe LGBT community are facing?
Okay, I will start with young girls. Most of the young girls, they do have a challenge of early pregnancies and also STIs, including HIV, because if you check the statistics of HIV, you find out the higher rate is for the young people. So this one is a general challenge. While for the women, there's also a very big problem in terms of family planning. You find out that most of the women in the community, they do complain about unplanned pregnancy. And they are failing to at least manage their families or raising up their kids well, because with poverty, if you can have maybe 4 to 5 kids, it means you cannot manage to at least manage all of them. So it's a very big challenge to the women in the community. So for the men, I think it's about the STIs, which is most common with the men because they don't have the knowledge of sexual reproductive health rights. So our work, it goes into this group of people based on their problems. If you talk about the LGBTI, they do also have problem of having maybe the STIs, because people, they believe that maybe they don't have they don't do sex while they do sex. So whenever they have a problem, they'll be denied to have services in the hospitals, in the public hospitals, because they are not recognized as any other person here in Malawi. So it's a very big challenge. That's why we do also accommodate them to make sure maybe they do use also the condoms, and they can also abstain whenever they want to have unprotected sex. So I think that's the main problem with the lack of sexual reproductive health rights services and information in Malawi.
Yeah, thank you for this, because it's interesting. I don't know if there's a women condom in Malawi, because women condom is now also available for women, but there's something you said about family planning, and somehow the statement gears towards women only, right? It takes two to tango. So I don't usually look at those as solely responsibility of a woman, there should also be a very big accountability on the men's side. Don't get me right, biologically, women has more control over pregnancy because of the biological ovulation. They know their timeline. So there has to be a big education or re-education on that because they can control. They will know when they're ovulating. But in terms of family planning, especially for married couples, the men should be solely, as well as the women, invested in their family planning. So I just want to make that issue. I don't know how you guys are looking at it from your perspective, but from my perspective, I think family planning should not be only the responsibility of women. It should also be the responsibility of the men that the woman is married to. So, but again, in terms of pregnancy, I think women has more control, biologically because of ovulation time frame. So, I don't know if you want to add something to this or you want me to move into the next question.
I think just to add, you were asking if we do also have the female condom. Yes, in Malawi we do have the female condom, but you find out there are few women who use those female condoms than male condoms, because a woman here in Malawi, especially in the village, to be found with a condom is a taboo. So most of the women, despite that we have international organizations who introduced these female condoms, but they are not adequately used by women. It's only women in town, but in rural areas, they don't much access these female condoms.
That's actually a very important information because of cultural issues. I understand that coming from Nigeria as well. I know the mindset of cultural separation between women having the right to have access to sexual practices. So that's well taken. And of course, towards the end, I will see what other experts in this podcast think about that specific issue, because that's an issue that we need to be open about and be open enough to discuss it and maybe start changing the way we view things. So moving forward, I would like to ask you this series of questions, which deals with the scientific evidence mixed with mixed to promote advocacy on the subject, meaning this sexual reproductive. So I want to know, what are the areas that you guys are working to be able to either, for example, are you observing a dramatic shift on advocacy regarding sexual reproductive rights, on acceptance, resistance, and pushback? That's one question. The second one, what are the adverse health outcomes? It could be social implications, mental outcomes attributed to restricted sexual reproductive rights. And the third one is, what are the pros and cons on societal level that can emerge from abuse of sexual reproductive rights? So, I mean, I can let you answer the first question, and then for the second question, I can repeat it back to you. So let's talk about, is there any type of sexual reproductive right acceptance within the community in towns and rural area? What are the resistance or pushback that you guys are facing?
Yeah, of course, there are other things which have been welcomed in the community. For example, the female condom, the male condom. We are able to engage the youth, and they are able to at least able to get some condoms in the community, and the community leaders, they are also part and parcel of encouraging the youth to at least attend to that. But there are other interventions, for example, for a certain group of people like the LGBTI, which is more resistance to the community and also to the religious leaders and even the government itself. The laws are not accommodative to such kind of people or a group of people. So it's something which now we do receive some pushbacks here and there, because despite that we have these bad laws and discrimination, but still more we do have our brothers and sisters who are into that category of LGBTI. So it's a very setback to us whenever we are doing our interventions, because in human rights we accommodate everyone. We don't discriminate people based on their sexual orientation or status. So yeah, so that's the main thing we are battling. Otherwise, when it comes to other interventions, well, the community is much welcome to accept whatever we are doing.
Okay. Just to remind you, you're no longer on camera, but the second question is, what are the adverse health outcomes, social implication, mental outcomes attributed to restricted sexual reproduction rights? So some of this stuff you talked about, restrictiveness of access to sexual reproductive rights to LGBT community, and women carrying condom. What are the, like the adverse on mental health or social mental health outcomes that are associated with it? If your organization notice any or have any idea the adverse impact, if any?
Yeah, there are social implications. For example, I'll talk about the unsafe abortion, especially for young women.
Okay.
It has also bring a lot of mental health issues to the young women who does the unsafe abortion, and they are in complications. So it's a very big problem here, because the number of young people, for example, women and girls who have gone into the unsafe abortion is very alarming, because the law is not allowing them to have a safe abortion because of other restrictions. So this one is also a problem which brings mental health problem to the women and girls who are into the unsafe abortion. Again, I've already talked about the LGBTI. Most of them, we have received so many cases of suicide because they are denied some of the access and information on sexual reproductive health, especially in public hospitals. So those who cannot afford private hospitals, it means they cannot get any help anywhere, because they are in denial that whenever they go into a public hospital, they can be arrested or they can be harassed by medical doctors there. So it's a very big challenge, of course, but still more, we are engaging with government to change some of the policies which discriminate a certain group of people.
So that's interesting. That seems to be like there's a law against LGBTQ in Malawi.
Yeah, including the law against unsafe abortion.
Okay.
I mean, safe abortion, not because most of the girls and women, they are into unsafe abortion because there is no law which can allow them to have a safe abortion.
So then let me ask you this. If somebody was raped, not somebody, if a girl was raped, a woman was raped, or there's an incest that happened, she happened to get pregnant, isn't it rational for the government to think this is right for that woman to make a decision about the pregnancy, to either terminate it or carry
Of
through a full
course,
term?
within the laws or the penal code, there are exemptions. And some of the exemptions are those where a situation where
Okay, I think you're frozen. You are frozen right now. We get to the right part of the whole stuff, and now you're frozen. Sorry, guys. This is an international issue connection. Let me see if I can get him back. He was frozen. Okay, I think he was frozen, and he's gonna be joining back. Sorry about that. Yeah, Africa need to increase their technology. Give him a little minute to. Okay, here you go. Thank you so much, Henderson. You were kicked off. So go ahead and address the question about the exceptions for the abortion in Malawi.
yeah, I was saying our laws, they do have exemption. So one of the exemption is the one you have already said, that if a girl is raped and there is evidence that the girl is raped and there are complications, then she can be allowed to do an abortion. But apart from that, it means there is no any chance for a girl to have a safe abortion. So that's why most of the girls.
You got disconnected again. You are still on, but
My network is not okay.
okay, I can hear you now. Go ahead.
Yeah. So I was saying those we have few exemptions for safe abortion, and there are so many procedures with those exemptions. That's why most of the girls, they are not allowed to do a safe abortion, and they are into unsafe abortion.
Okay. It's also genetic, or kind of like if a woman has a risk, let's say the woman is married, and then it happens that she will have complication with the pregnancy. Is that part of the exception as well in the law in Malawi?
Yeah, for the health of a woman is also one of the exemption. If the woman have some complications on the pregnancy, and is confirmed by the professional medical doctor, that's when they can have a safe abortion. But apart from that, it means no one can do any safe abortion to a woman without an approve that the woman maybe has some complication or has one of the exemptional rules within the penal code.
And that's clearly created a room or a gap for black market unsafe abortion happening in Malawi. I mean, that's kind of like seems to be the fact of what you are saying, right?
Exactly, because now the government is able to notice that many young girls, they're into unsafe abortion because of the complication after abortions. So if you go to public hospitals, for example, some public hospitals in town, like the one we have here in Branta, at the gyna department, you find they have a lot of cases of girls' complications for unsafe abortion. That's when the government realized that most of the girls, they are doing unsafe abortion elsewhere.
Wow.
And the civil society, they also gathered to petition the government. There's already a bill in parliament, but now the bill is challenged by the public demand, especially with the traditional leaders and also the religious leaders. They are saying the members of parliament should not pass that bill into law because they don't want people to be doing the safe abortion.
I mean, this actually is really, really interesting and really harsh a little bit, maybe more bit. The fact of what I'm trying to get to, there's another question I was going to ask you, which is about looking at pros and cons of societal level that emerges from abuse of sexual reproductive right. And now I feel like, was there even need to ask the question, but I ask it because if you don't even have the right to have sexual reproductive rights, specifically for, I mean, like we already discussed, sexual reproductive rights is not only abortion. There are so many, areas and components of sexual reproductive right. That's why I always want to start away from certain things because that's what's being pushed in the media. I think there are so many varieties of sexual reproductive rights. Abortion definitely is one component, but does the government has any type of evidence that for abortion now, and I'm not going to generalize it to all areas of sexual reproductive right, but does the government has evidence that there will be an abuse of abortion if it's legal for that to happen? Because I don't want anybody to get what I'm saying wrong. There's always an abuse in any type of situation you can think of. Always an abuse. So is that what's prompting Malawi government to put those restrictions?
Not really, but maybe for the religious leaders and also traditional leaders, they are the ones now who have that mind of thinking that maybe allowing people to do safe abortion, they can abuse it and they'll be just doing it anyhow. That's why when the members of parliament are going out to do consultation with the community, there's always a backlash with the community to say, no, we don't even talk about that. We cannot allow that one to happen. So it's a very big challenge. They even don't want to listen to the views of other people who are complaining about it. So when it comes to the abortion bill here, it is much denied by the community not the politician themselves. So the politician, they are just following the community because they will need vote. So they don't want to disappoint the community. They'll say, okay, we're not going to discuss that one. We'll put aside. So it has been there. Now I think it's, if not the third year, the bill is still hanging in Parliament.
Thank you for the information. And I think the community should also realize and have the same energy to be able to know that a lot of women's life is being destroyed by unsafe abortion, because the restriction they're having right now is creating an abuse in the community of Malawi, whereby it's pushing black market abortion, which most of these people probably, I'm not in Malawi, but you probably know this better, who probably doesn't have the expertise or the cleanliness or the skill to actually perform safe abortion. And I think maybe some of this abortion will end up destroying the life of that woman or girl. Maybe after they end up getting married, they probably will not have kids because of the fact that, if they survive the unsafe abortion, somebody that doesn't have the skill just mess their, internal organs up that they can't even conceive. So that's also a social issue, since the burden is on the society to make certain calls. They have to start thinking about the reality of things in the 21st century. Why are they not cracking down on this unsafe abortion that you discussed that are creating a lot of issue in the community? I think that's one thing I believe, and I know that it should be important in the community to address among these community leaders as well. But let's move forward into understanding the purpose and significance of enhanced advocacy for sexual reproductive rights in Malawi. So what do you think are the purpose? What do you think are the significance of enhancing advocacy for sexual reproductive rights in general, not just one component of sexual reproductive right, which is abortion, but in general, social reproductive right?
I think here in Malawi, the main aim is to reduce high rate of maternal mortality rate, which is also high. And the one which we have just finished discussing, the unsafe abortion, and also teenager pregnancies. By influencing policies and empowering communities to at least challenging the harmful cultural practices within the community. So some of the significance is that the sexual reproductive health rights have managed to at least improve the maternal health and also empowering women and girls, including reduced teenager pregnancies, which we have also discussed at length. So I think basically that's what I can say about the purpose and the significance of sexual reproductive health in Malawi.
Okay. And I wonder also, I know you already touched on this question I'm about to ask, but I want to see if there's some more additional information I can excavate from it. The access of cultural themes, social indicators, religiosity, spiritual aspects, economic implications, and political construct that poses any risk of sexual reproductive rights in Malawi?
Yeah, of course. Maybe to start with some cultural issues, which we have also discussed on top. For example, for us, we are running a certain project in the rural area of Blantyre, and it's about menstrual hygiene. And when we are doing the research, it was noted that most of the girls at a tender age, once if they start the menstrual, when they went back to the community, they do meet some elders there. And those elder women, they will tell those girls that now you are grown up, you need to get married. This is the sign of you to get married. So immediately that girl, it means she will drop out of school, then she'll go to find someone to get married. So these are some of the cultural issues which also bring implications to the young girls, because once they married at a tender age, they do have a lot of problem, like when they are delivering, complications, pregnancy complications, and also maybe some of them they do catch HIV in a process. So it's a very big concern also to the community. Again, on economic complications, like I said on the statistics on top, that teenager pregnancies, they are much higher in rural areas than in urban areas. Because in urban areas, a child coming from a rich family is able to be protected and also given a rightful information about sexual reproductive health rights. While a young person from the village is denied to have the sexual reproductive health rights information and services because of the cultural and also religious beliefs which hinder them to have that access. So you can find out that the economic implication about those who are coming from rich families and those who are coming from poor families, they do have a different results when it comes to access to sexual reproductive health rights and services. Again, on political, we have already talked about some of the laws which also deny a certain group of people to have access to sexual reproductive health rights, including the penal code, which denies women to access safe abortion, and also the LGBTI to be recognized so that they can able to have treatment into public hospitals and also clinics. So I think that's what I can say about the implications.
Yeah, I always believe that people have rights to their body, especially adults, right? So adults have really right to do whatever they want to do. That doesn't harm somebody else. But when it comes to children, that is off limit. So I think there has to be some type of things that Malawi society need to think about moving forward. So in terms of community and political leaders, are they doing enough? I remember you said that basically, I don't know if you already answered the question that I'm about to ask, because they're trying to please the community because most of the resistance is coming from the community. But I have to ask, if you, based on the work you are doing and the work you've done on this subject, do you believe that the political leaders are doing enough to support sexual reproductive health rights? And if so, how?
Yeah, I think in areas where we have collaborated with the other key stakeholders and we have done enough interventions on influencing on harmful cultural practices, some of those communities now they have changed their way of doing things, and they are able to at least understand what sexual reproductive health rights is all about. Mm-hmm. So, for example, in like I said, Blantyre, Chilazro, we have 3 districts where we do our interventions on sexual reproductive health rights, influencing harmful cultural practices to be removed through their understanding on how best we can help our children and the community to have that understanding of sexual reproductive health rights. So we do community dialogues. We do also community mobilization outreach, at least to reach out to community leaders, religious leaders, so that they can able to understand the concept of sexual reproductive health rights. So whenever we are doing this intervention, we do work hand in hand with the Minister of Health. So it's a collaboration of Minister of Health, the police, the judiciary, and also the community. So the community will involve the community leaders and also the religious leaders, at least to make them understand, because they are the heads in the community.
Yeah, thank you. And I think what will actually also help African communities, specifically Malawi, is data. I believe that data informs knowledge and information, right? So that being said, do you, in Malawi, for example, is there any surveillance system to capture data regarding to sexual reproductive rights? You know, maybe prevalence of what we talked about in terms of unsafe abortion, you know, capturing prevalence of use of condom, catching prevalence of infant mortality, maternal mortality. Is there a system in Malawi that routinely capture these on annual basis? And if so, because I believe that if you have that level of objectivity, it will start to make impact in the community, knowing the numbers, right? And if they do have that, how are they using it? If there's none right now in Malawi, is there any plan to implement a surveillance system specifically for sexual reproductive rights in Malawi?
Yeah, I think Malawi sexual reproductive health rights data are captured through a variety of systems, including national surveillance, health and management information system, which is HMIS. And this one much also focuses on the key population. And we do also have international organizations like UNFPI and UNICEF. I think these are some of the international organizations which also helps on capturing of data here in Malawi. We do have statistics on sexual reproductive health rights issues, and it's within the system of the government through
Yeah,
the institution I've just mentioned.
yeah. And also what could be also what slows down the adoption of the idea could also be how those data that are being captured are shared within the community, whether it's shared in the rural area, on maybe a quarterly basis. There has to be a way to share information so that when you do go to rural area, it will not cost you more time for re-education. Because if people don't have the information, it's hard for them to know what are the social implication or adverse health outcome that might come out of something. So I think there might be a way for not just having the surveillance system, but also how do you share or disseminate that information? That's very, very important. So based on your advocacy work at YOCADE, what are the findings and uh, social implications of sexual reproductive rights in the communities? And also, I will add also, what are the lessons learned on sexual reproductive rights? Those two areas. Can you cover that, please?
Yeah, some of the social implications on sexual reproductive health rights will include improved health and well-being of the youth and especially the women and the marginalized group of people like the LGBTI. Also economic empowerment and reduced gender disparities. Some of the lesson learned is that we have able to notice that every area has its own cultural aspects, how they understand the sexual reproductive health rights concept. And when we are applying, we need to involve the community so that we can able to make them understand what is our point when we are pursuing the sexual reproductive health rights. It's something which we have learned through our interventions, because once you bring a certain subject in a different community which does not allow that subject, it means they will not accept you, and they will even not accept what you are telling them. So to make them understand, it means, first of all, you need to understand, because there are some other areas here. For example, we have a certain district, this Mangochi, is dominated by the Muslim. So you cannot go there and start talking about maybe issue of abortion. They will not accept that.
And this is the issue I'm talking about, because like when we talk about sexual reproductive rights, health rights for men, women, and LGBT community, the focus should not be on abortion. Somehow, the mainstream media, and I think I also blame public health intervention, put that focus on abortion, but it shouldn't be. There are so many important areas of sexual reproductive right that should be the forefront of why women should have, rights on sexual reproductive rights, why men should have, if they not already have the right for sexual reproductive right. But once it comes in and we're talking about sexual reproductive right, we have this veil of abortion that becomes a bigger issue. So I think it has to be, this is a problem for public health. We need to reconstruct how we sell the sexual reproductive right. It should not come in and people thinking abortion. Yes, abortion is one single component of sexual reproductive right. There's other phases of sexual reproductive rights should also come in place. And I want experts on this to start thinking about this because that becomes an issue when you're just gonna shut down sexual reproductive right because all you see in the, for example, Muslim community or Christian community or cultural community is abortion. And it's something that we need to work hard on. We cannot just continue like this, living in 21st century, so blind to facts. So I'm gonna ask you my last question, then I'll open it up for the audience to ask you more question or comment on this, what we have discussed. Uh, the last question is, what are the practical implications of your advocacy work on sexual reproductive rights in public health, clinical, and community settings?
I think I will talk much on the community settings. We have done a lot of intervention within the community, especially targeting young girls, issues of reducing teenager pregnancies, and also understand their problems, why many girls are into early child marriages. So, like our organization, we are much focusing, I should say, into girl child education. So whenever we are focusing on girl child education, that's why we are looking at some of the bigger problems which also hinder girls to at least finish their education. So some of them are the early pregnancies and also issues of menstrual hygiene management, including STIs, HIV. So we do those interventions to make sure young girls, they are protected in the community settings, and they have also the right to at least seek for sexual reproductive health services and information. And we have managed to create some safe space within the community so that young girls can able to at least access the services without maybe having a problem of walking a long distance or going into the main hospitals. So this one have also helped so many girls to at least start knowing their rights and understanding the concept of sexual reproductive health rights.
Thank you so much for this amazing comeback in public. I really appreciate all the work your team are doing in Malawi. Thank you so much. And now I will open it up for everyone to ask questions, make comments, or provide constructive suggestions on how YOCADE can improve the work they're doing on sexual reproductive rights in Malawi. And also, this is a good thing because I know there's a lot of people from other African countries that join this podcast. If you're doing work in this area, please link up with Henderson to be able to share information and maybe partner with him or his organization to do a lot of work. I also put my YouTube channel in the chat right now. Please, please, please. We cannot succeed in this monthly podcast that we do without subscription. Subscription is free, it's not charged. Please, if you can click the link that I put in the chat right now, and if you have not subscribed to our channel, please do us a favor, subscribe to our channel. That will increase the algorithm for whatever podcast we do to be seen by a lot of people. And that being said, there's a question or few questions in the chart that I have to read. One came from Oloribe, Professor Oloribe. I will read the question, and I don't know if you already addressed the question throughout this podcast, but what he asked is abortion legal in Malawi? I think that was already cleared. Do people have access to family planning resources? Is sexual education taught in schools and colleges? And what is the prevalence of illegal abortion and its consequences? I think Professor Obinna, I think the information he provided, he may have answered all these questions, but I will leave it up to Henderson to address this question. Again, the questions are, is the abortion legal in Malawi? Do people have access to family planning resources? Is sexual education taught in schools and colleges? And what is the prevalence of illegal abortion and its consequences? Yeah, Henderson,
You can hear me?
can you turn on your video? By the way, anybody now, you can turn on your video if you want, since we are on the question section now. So did you hear the questions I posed? I think it came from Professor. Go ahead.
You can repeat it.
Okay, so is abortion legal in Malawi?
Okay, the abortion is illegal. It is only allowed in some other circumstances where a woman has some complications, but not all women are allowed to do the safe abortion.
Okay, so we know that, and I think we also know the answer about do people have access to family planning? I think you covered that. And the one I think you have not covered, I think you even covered the prevalence of illegal abortion, I think, but you didn't say the number. But we know that you mentioned that there's a lot of illegal abortion. But is sexual education taught in schools and colleges?
Yeah, of course, the government has introduced a new curriculum, and sexual education is also part of the curriculum, which we have also started to learn in primary schools and also secondary schools, including at tertiary level.
Okay. Okay, Obinna, I hope your questions are answered. So I'm gonna go, there's hands up here. Let me go first to Teresa, and then after that, I'll go to Zach. Teresa, go ahead with your question. And if you can, if you have a video, you can turn your video on if that's okay.
I'm sorry, Dr. Melu. I'm in a event. I just took liberty to be away from the event to attend this podcast.
No worries.
Yeah. Thank you, Anderson. I think you brought a lot of good information to our understanding. And you made it very explicit. I only have one question for you. The psychosocial implications, the economic and the disparities, the illegality of abortions in Malawi. However, from every single situation that I've been made aware, what we consider the urban lifestyle syndrome affects everywhere, even in the United States. meaning that the so-called urban area, the township girl, we call them in Nigeria, they travel home, including the men, to infect the young girls in the rural area or villages. How do you mitigate that? Am I on?
Yes, we heard you.
Okay, how do you mitigate this? Because this is a major concern that some of us in our own little way, little program, we've tried to put a cap, but we can't do anything about it because the men who lives in the big cities travel home on a weekend, just no hold back, meaning they can do whatever they want to do. And the young women or women in general, let me put it that way, who lives in the city also come back to the villages. I don't want to say rural area, to the villages where these young men and women seem to be stagnant because of lack of economic opportunity. How do you mitigate this urban health syndrome in Malawi? That's
Yeah,
number
I
one.
think
And I'm sorry, so that I don't take much of your time. Then subcategory of that questions is that are women sitting at the decision table in the parliament to frame decision-making concerning reproductive health in Malawi? Thank you so much.
Thank you very much. Firstly, let me respond to your first question about young men or people from town going into village and how can we mitigate it. I think it's something which I've been saying to say that we need to intensify the knowledge on how young girls in the community or in the villages can able to also protect themselves, because most of the young girls in the village, they are much vulnerable, especially here in Malawi, because they don't have knowledge and they think those who are coming from town, they are the ones who can able to at least save them from their poverty. So it's an issue where before they come to the village, this village girl, they should already know something on how they can able to protect themselves, like some life skills. On the other question about women in parliament, of course, it has been an issue. That's why if you see from 2020, there have been some advocacy trying to make sure we have women representation in parliament or in decision making, not only in parliament, but in decision making position. I think up to now, including UN and other international organizations, they are still pumping in a lot of resources to make sure women, they have at least a good representation on most of the decision-making positions. That's why you can see there's so many call for proposals about women to at least take part on decision-making. So here in Malawi, even this, the election which has just ended last month, we have at least noticed that 8% has gone high for women representation in parliament. So we are striving on that one. Thank you very much.
So this is a good question.
Dr. Omelu, I'm sorry. I need a clarification on one thing. Because Henderson.
Hold on.
Okay.
Before the clarification, I wanted to speak on this.
Okay.
I want to make it clear to everyone that everyone in Africa comes from a village. So I want to make this clear, the construct of a village. There's no person in Africa that doesn't come from a village. That's a fact. So in Africa, it's structured into tribal groups. So when somebody moves out of a village due to maybe job or education and stuff, they go in there. Yes, there might be, and by the way, before I even jump into this, any township in Africa used to be a village. So as it develops, different lifestyle emerges within that. So at the end of the day, obviously the day will also end, is that the fact is, the question also, more important question we should be asking is the family integrity. That's what we should be asking in general about Africa. I think most of us in Africa are lost. We are definitely lost. There's a lot of family disintegration happening. And I think a child will be safe if there's a strong cultural family values that is already instilled in a child. No matter what situation they encounter, they will be able to navigate that. The fact that there's what Teresa asked, and there's a lot of women falling vulnerable to this type of behavior. People that used to come from village, went to town, coming with a different lifestyle, uh, doing whatsoever determines they can do what they want to do, has to go back to saying, okay, what are these kids' parents? I mean, what values are they instilling in their child? So it's not going to be one hand fits all, whereby we can say, okay, the fault is solely from people traveling from the city to villages. At the end of the day, we need to also start thinking about what are the family values we have now in the 21st century. What are the values that parents are instilling in their children? And those are important questions to also think about. Go ahead, Teresa. Teresa, go ahead before I go to Zach. You're muted.
Yes.
Okay.
It's not a question, it's just kind of a comment, and I don't know how you see it, Anderson, and the issue of sustainability, because whenever you mention UN, UNICEF, World Health, and all that stuff, I call them as ad hoc services, because for Africa to maintain a good health or good socioeconomic viability in 21st century, the issue of sustainability has been an issue in my own head. And no matter where I go in many parts of Africa, the problem is exactly the same. How do you envision? I know it's beyond your scope because of limited resources, but as someone in community, how do you envision a sustainability of this sexual reproductive health among the women in the villages and among the men in the villages? Because there must have to be a buy-in, and that buy-in comes from a man and a woman. And Dr. Melo earlier said it takes two to tango. That's where I'm coming from. However, in order for any implementation to be effective, there must be sustainable work plan. What are the plans in place to have a sustainable outcome in the villages?
Thank you very much. I think what we are doing so far is to make sure we engage the community, not only the women or the girls, everyone within the community, and build up a strong structure that can sustain the program. And our program, we do engage community, people in the community, I should say, whom we do train on different skills so that they can able to continue doing the services. That's why we do introduce safe space within the community, so that even the program ends, those people who have been trained can continue doing the activities. I think that's the strategy we use. And this international organization, yes, they do ad hoc activities, but now with localization, they are supposed to work with the local organization and grassroots organization, so that this grassroots organization can able to continue when the international organization leave.
Okay, that's perfect. Thank you. And thank you, Teresa, for the amazing question that you posed. I'll turn it over to Zach. Zach, go ahead.
Hi, Doc. Can you hear me?
Yes.
First of all, thank you for inviting me. Very informative, excellent podcast. So, two questions. So yeah, this is new information to me. I'm kind of naive to it, but it's very informative. First question: this problem, is it widespread throughout the continent of Africa, or is it just more prevalent in Malawi? Second question: when you are giving the preventive education, I'm interested in what's the reception you're getting from the young men. So those are my questions.
Sorry, can you come again with your question?
Okay, can you hear me?
Hello, can you hear me?
Yes, I hear you now. So my question, first question, the problem that you're having with sexual reproductive, is that a problem that's widespread throughout the continent of Africa, or is it just more prevalent in Malawi? The second question, when you are giving your preventive education, especially to the younger people, I'm interested in the reception that you're getting from the young men.
Okay. First, let me answer your first question to say that sexual reproductive health rights problem is a common problem in most of African countries, because we do share the cultural and also most of the things like religious issues. We are like the same. So, but I was just talking about our country, Malawi, what we are experiencing and what we are doing so far. What we are getting from the young people when we are doing our interventions, I think I've already said that there's a mixed outcome. Some, they have, they will accept. Some, they will have to reject some of the information. So that's how it goes, but it depends on the district, because here in Malawi we have 28 districts. So within the district, most of the districts, they have different cultural cultural practices differ from other districts. So you find you go into the other district, maybe you can be welcomed and you can do your intervention. They will at least for whatever you teach them. You go into the other districts, it becomes hard because of how the culture is built up in that particular district. I think that's how it goes here in Malawi.
Great. Thank you, sir. Got it.
Yeah, and just to add to your question, Zach, that's a very, very great question that you posed. And I agree with the assessment that our brother Henderson provided. We have problem in our African continent. Science, technology, infrastructure, capacity building is not improving the way it should be improving. and I agree with Henderson. Religiosity has a lot to do with these issues, whereby we have gone to the point where we get to, total depravity, whereby we think, due to religiously and perhaps culturally, that somebody else is going to do the work that we're supposed to be doing. I also have to add it to the issue. I wrote a paper last year on sustainability, and my paper focused on California intervention for colorectal cancer. Even here in the US, we're having an issue with sustainability. And I agree with Dr. Ogidi Teresa that just posed that most of the funding, whether it's a sexual reproductive rights that you get for this program, doesn't come from the continent. It's like they have plates on their hand begging for money for every health outcome you can think about. It's either coming from World Health Organization, either coming from CDC and other European agencies. That should not be happening in the 21st century in Africa. The question is, why is this continue to happen? Because you can never develop a country without sustainability. You can never develop a continent and develop the mind of the people when they are still mentally enslaved. So there's a bigger issue, and unfortunately, it does not only apply to sexual reproductive right. I can go to cancer issue, the same issue will happen. I can go to a lot of health outcomes. It's just the same across any African continent that any African country you can go in the continent. So it's not unique to Malawi, but hopefully the younger generation will start to look at the problem we have in the entire African continent and start to make or start to ask a different question and start to make a different decision, because the older generation, I can tell you right now, failed Africa. There's a lot of them that actually try to change, like Lumumba and so many of them that try to change Africa, but obviously there's also a string of American, European influence that still hold Africa back. And that deals with, other issues of slavery. But I will not only come into excuse that and say, well, because Africa has the highest potential in resources, mineral resources, all type of resources is there in the continent. That's where the money is. Why should Africa continue to beg money for simple things that they can afford to do? And that's a bigger question. Thank you so much for that. Teresa, you raise your hand again. Any additional question or comment, or anybody else has anything to say?
No, Dr. Omelu, I think I didn't bring it down. Thank you so much.
Okay.
Hello. I thought I was leaving.
Okay, hi, Professor Rosemond. Go ahead.
Yes. I need to make a few suggestions. Thank you very much, Henderson. Thank you very much. Those who have contributed to this discourse. I think it's a useful, extremely useful topic, and I don't think we can exhaust all that we need to know and learn and contribute to in just one session. That would be my first recommendation, that we bring it up again, maybe somewhere next year, and to have a follow-up on this.
I agree.
Yeah. So I would want to just highlight a few things that are happening in Botswana that maybe Malawi can also take from. When the host, when he brought up the issue of male involvement, it reminded me of the opportunity that I had working for UNFPA that enabled me to contribute a strategy. I mean, they call it male involvement strategy. It's very interesting. Male involvement strategy. Why? For SRH back then. At that time, the rights was not a component yet. Do you realize that the right is kind of a new development?
It's true.
And so back then, we were talking about SRH. Those who have been in the system for a while, it was SRH. And then we had the R. There's nothing wrong about it. But when you look at the three key rights, we're talking about autonomy over one's body and making the right choices. We are talking about access to accurate information and healthcare services. And we're also talking about freedom from discrimination, coercion, and violence. When you look at all these three, depending on the country, we are expected to adopt and adapt. So we did that. We have done that in Botswana. And somehow I was still the consultant looking at SRHR linkages in the entire health delivery system in Botswana. It wasn't an easy task, but we did something, and you realize that the good thing about this linkages strategy, call it, that we developed, we had an elaborate action plan, call it. We brought on board all kinds of collaborators, including the faith-based organizations, NGOs, CBOs, and so on. And it will interest you to know that all these partners had to actually come on board with whatever they have to offer. If you are not comfortable with reproductive health, which includes safe abortion services, you don't touch it. But of course, if you don't touch it, you have to have something that deals with unsafe abortion or stay away, whatever. Because the key issues of reproductive health were laid out. Maternal health, which includes prenatal, delivery, postpartum, and of course, safe abortion services. And then, even most critical, prevention and management of reproductive health issues, which includes infertility and menstrual health. I heard Henderson mention menstrual health. Sometimes that eludes us. We forget about that. And we don't have NGOs in this area. But for us, because we're looking at comprehensive SRHR, we included all that. And we were looking at the entire health system. The entire health system, of course, at the helm of affairs was Ministry of Health, and it's still Ministry of Health and Wellness. We've added wellness to it. And then partners, the private sector was there, CBOs, NGOs were there, and so on. So it was elaborate. So in addition to the male involvement, this male involvement strategy is as if males are always left behind. It was like an afterthought, but it was something that UNFPA did, and I think it is still a flagship of their strategies to say, male, come on board, even though we forgot about you. Come on board, come and be part of it. Reproductive health without men is unthinkable. And so that male involvement strategy is a strategy that is guiding how men can be included. And if you look at the rights, the three angles of the rights, it's freedom from discrimination. No one is going to be discriminated. So even if we discriminated against men. Now they are on board looking at the male involvement strategy. And then, Doctor, you were talking about access to data. It's very critical. We are saying access to accurate information and healthcare services is the second of the three angles of the rights. Very good. And so if we are looking at the rights in its entirety, we are looking at all the three and not leaving one out. And also that brings me to my key suggestion to Henderson. I was asking myself, what's your focus? What's your niche? Look at the three rights. Look at the 6 blocks of reproductive health and sexual health. Look at where your niche is and make sure that you are making an impact, because if you are all over the place, it's not going to be easy. And so that will be my key suggestion, that you do that. Get your niche, identify it, and do it to the fullest. If, for instance, prevention and management of reproductive health issues, which includes infertility and menstrual health, it's something that you can do. It's an entry point for you to achieve the rest progressively. Do that and get the right collaborators to be with you. Thank you.
Thank you for the advice. I think it is noted.
So you can have access. These are documents that I did many years ago, but the male involvement strategy is still there. The linkages, SRHR linkages for Botswana is also available. I can share those.
Thank you so much, Rosemond, Professor Rosemond, for this suggestion. I really appreciate that. It's very constructive. Henderson email is in the contact, so that you can share additional information with him. Also, thank you so much for reinforcing and reinstating the male involvement comment I made earlier. I think it's very important. It takes two to tango. Men in any community should be involved in sexual reproductive right. There's also sexual reproductive right. They are also included in that. So it should not be a marginalized case study whereby it's a women agenda. It should be a family agenda. Men should be involved. Thank you so much for that clarity. And there's nothing else to say about that, because that's a fact that should be addressed. We should not run away from this issue. And also, like you said, and I also mentioned it, there's a variety of components for sexual reproductive rights, and we should be comprehensive about that. We cannot allow one item to become the face of sexual reproductive rights, and that's where sometimes in the community, we lose the community, because everybody has one directional view of sexual reproductive right. It does a lot beyond abortion, like you mentioned, prenatal care, infant health, maternal health. There are so many. That's very, very important, including prevention. So I really thank everybody for participating in this podcast. If anybody do not have any additional comments, question, or suggestion, I will end the podcast. But if you have any question or comment you want to post, please let me know, so I can allow you to have that time to ask the question. Next month, we're gonna have a professor from Burkina Faso presenting on endocrine disruptor. So I will also be sending the flyer out to everybody, sometime first week of next month, so that if you have time, you can add it in your schedule. Please, again, if you have not subscribed to our channel, please, I'm asking, go ahead and subscribe. I would be posting this podcast in the public YouTube channel either today or tomorrow. It will be in there. And if you already subscribe to our channel, you will get an alert that a new video has been posted. And if you get that, please do us a favor, share with everyone. If you're a professor, share with your students, because we need to start disseminating this type of information. We cannot make a change if people didn't know the struggles we are trying to fix. So the more we share the information, the more awareness we create in the community, and then that makes the advocacy so powerful at the end. So thank you, everyone. And today is Saturday, October 25th. Have a wonderful weekend. And I'll see you guys next month.
Thank you.
Thank you.
Thank you.
Thank you very much. Merci beaucoup.
Merci.
Au revoir.
Au revoir, monsieur.